After 60, dark urine is not always just a sign that you forgot to drink enough water. That is what most people assume first. They see darker urine in the toilet and immediately think, I just need one more glass of water. And yes, sometimes that is exactly what it means, but sometimes dark urine is not about water at all. Sometimes it can be connected to a medicine, sometimes it can be linked with a bladder infection, sometimes it may be a sign of blood that is not bright red. Sometimes it may point toward kidney stress, and sometimes the warning may not even start in the bladder. It may start somewhere else in the body. That is why today's video is so important, especially if you are over 60, because your body does not always shout when something is wrong. Sometimes it whispers, and one of those whispers can show up in the bathroom. I'm your host, and on this channel, we talk about simple, practical health information for adults over 55. No panic, no miracle claims, no fake promises, and no complicated medical language. Just clear information that can help you notice changes earlier, ask better questions, and protect your independence. Today, we are talking about dark urine, what it may mean, when it may be harmless, and when it may be a sign that you should not ignore. And please stay with me until the end, because the final reason is the one many people never think about. It can make urine look dark brown, tea-colored, or even cola-colored. But the problem may not be in the bladder at all. Before we continue, comment your age below. Also, tell me this. Have you ever noticed your urine getting darker after hot weather, after taking a new medicine, after being sick, or after not drinking enough water? Just write something simple like, I'm 67, yes, or I'm 72, I never noticed. Your comment may help someone else pay attention sooner. Let's make this very simple. Think of your body like a house with plumbing. Your kidneys are like the filter system. All day long, your blood passes through these filters. Your kidneys help remove waste, extra fluid, and substances your body does not need. Then that waste leaves your body as urine. When your body has enough fluid, urine is often light yellow. It does not have to be perfectly clear. It does not have to look exactly the same every day. But usually it should not look extremely dark, brown, red, or cloudy for no clear reason. When urine becomes darker, one common reason is that there is less water mixed with the waste. Imagine making a cup of tea. If you use a lot of water, the tea looks lighter. If you use less water, the same tea becomes darker and stronger. That is one simple way to understand dehydration. But here is the part many people miss. Urine can also become darker because something else is coloring it. A medicine, a vitamin, a supplement, a food, blood, bacteria, liver-related pigments, or substances released after muscle injury. So the real question is not, is dark urine always dangerous? No. The real question is, what else is happening with it? If dark urine happens one time and then goes back to normal after fluids and rest, it may not be serious. But if it keeps happening, becomes very dark, looks brown or red, or comes with other symptoms, then it deserves attention. Ask yourself, did it happen once, or is it repeating? Is it dark yellow, orange, brown, red, pink, cloudy, tea-colored, or cola-colored? Are you urinating less than usual? Do you feel dizzy? Do you have burning? Do you have fever? Do you have back pain? Did you start a new medication? Did you recently fall? Are your eyes or skin looking yellow? Do you feel unusually weak? These details matter. They help separate a simple hydration issue from something that may need medical advice. The first and most common reason is dehydration. But after 60, dehydration can sneak up quietly. Most people think dehydration means extreme thirst. They imagine someone sweating badly in the hot sun, desperately needing water. But in real life, especially after 60, dehydration can be much quieter. You may not feel very thirsty. You may be drinking some water. You may think you are doing fine, but your body may still be running low. This can happen during hot weather, after exercise, after diarrhea, after vomiting, after fever, or when someone takes medicines that make them urinate more. Some adults also drink less on purpose because they do not want to wake up at night to use the bathroom. That sounds practical, but it can backfire. If you avoid fluids all day, your body may become dried out before evening even comes. Here is what happens in simple language. When your body is low on fluid, your kidneys try to save water. So instead of letting a lot of fluid leave the body, they concentrate the urine. That can make it look dark or yellow. Dark urine along with dry mouth, dizziness, tiredness, and urinating less than usual can be a clue that your body needs attention. For example, imagine someone who is 68. They wake up, drink coffee, eat a small breakfast, then spend the afternoon outside in warm weather. They do not drink much water because they do not feel very thirsty. Later, they feel tired and a little lightheaded. When they use the bathroom, the urine is much darker than usual. In that situation, dehydration could be a real possibility. But the important thing is to look at the whole picture. Dark urine plus dizziness, dark urine plus dry mouth, dark urine plus very little urination, dark urine plus weakness, that pattern matters. What should you do instead? Do not wait until you feel extremely thirsty. Try to drink fluids steadily earlier in the day. If plain water feels boring, you may use options that fit your health plan, like soup, water-rich fruits, or other fluids your doctor allows. But be careful. If your doctor has told you to limit fluids because of heart failure, kidney disease, liver disease, or another condition, do not suddenly increase water on your own. Ask your clinician what amount is safe for you. A simple habit is to check the trend. If your urine is dark first thing in the morning but becomes lighter later, that may be less concerning. But if it stays dark all day, or you are barely urinating, or you feel dizzy, confused, very weak, or faint, do not ignore it. That is when you should seek medical advice. Also, do not save all your water for nighttime. Many people drink too little all day, then drink a lot before bed, and then they wake up again and again at night. For many people, steady fluids earlier in the day work better than drinking too much late at night. The second reason dark urine can happen is medicines, vitamins, supplements, and foods. This is one of the most overlooked reasons. Many people only connect urine color with water. But your body also uses urine as a way to remove substances after breaking them down. That includes parts of medicines, vitamins, food pigments, and dyes in certain products. So urine color may change after you start something new. A prescription medicine, an antibiotic, a vitamin, a supplement, a pain reliever, or even a strongly colored food can change urine color. Some vitamins can make urine look very bright yellow. Some foods, like beets or berries, can sometimes make urine look pinkish or reddish. Certain medicines may also make urine look orange, brown, or darker than usual. Now, this is where people make two opposite mistakes. One person panics and stops the medicine without asking anyone. That can be dangerous. Another person says, "It is probably just the medicine," and ignores a serious symptom. That can also be dangerous. The smarter response is in the middle. Notice the change. Think about the timing. Then ask your pharmacist or doctor. For example, imagine someone who is 73. They start a new medication on Monday. By Wednesday, their urine looks darker or more orange than usual. They have no pain, no fever, no burning, and no weakness, but the color is new. Instead of stopping the medicine, they call the pharmacist and ask, "Can this medicine change urine color? And when should I be concerned?" That is a simple, smart, safe question. Keep a basic list of everything you take, not just prescriptions. Include vitamins, supplements, herbal products, over-the-counter medicines, and pain relievers. When urine color changes, ask yourself, did I start something new? Did my dose change? Did I take a new antibiotic? Did I take more vitamins than usual? Did I eat beets, berries, or strongly colored foods? But remember this, do not assume red, brown, tea-colored, or cola-colored urine is harmless just because you ate something colorful. If it continues, repeats, or comes with pain, fever, weakness, yellow eyes, back pain, or less urination, get medical advice. And never stop prescribed medicines without checking first, unless you were clearly told to stop because of a serious reaction. The third reason is a bladder infection or urinary tract infection. Many people think a bladder infection is always obvious. They imagine strong burning, severe pain, and constant bathroom trips. And yes, those symptoms can happen. But after 60, symptoms may not always feel clear in the beginning. Sometimes the first clue is cloudy urine. Sometimes it is a stronger smell. Sometimes it is darker urine. Sometimes it is pressure low in the belly. Sometimes it is an urgent need to urinate again and again, but only a little comes out. This does not mean every strong smell is an infection. It does not mean every dark color is an infection. But when urine changes come with urinary symptoms, it is worth paying attention. Here is the mechanism in simple words. When bacteria irritate the bladder lining can become inflamed. That irritation can change how urine looks, smells, and feels when it passes. You may feel burning, you may feel pressure, you may feel like you have to go urgently. You may go often, but not pass much urine. For example, imagine someone who is 66. They notice their urine is darker and cloudy. They also feel a little burning. They keep going to the bathroom, but only a small amount comes out. They think, maybe I just need cranberry juice. But if this is a bladder infection, waiting too long may allow it to get worse, especially if fever, chills, back pain, or weakness appears. What should you do instead? Do not rely only on home remedies if symptoms suggest infection. Call your doctor's office, urgent care, or a nurse line and ask if a urine test is needed. A urine test can help show whether there are signs of infection, blood, or other issues. If antibiotics are prescribed, take them exactly as directed. Do not use old antibiotics. Do not use someone else's antibiotics. And do not stop early just because you feel better, unless your clinician tells you to. The important pattern to remember is this. Dark urine alone may be dehydration, but dark or cloudy urine plus burning, urgency, lower belly pain, fever, chills, or back pain is different. That combination should not be ignored. The fourth reason is blood in the urine. This is where many people get confused. They think blood in urine must look bright red, but that is not always true. Sometimes urine looks pink, sometimes reddish-brown, sometimes tea-colored, sometimes cola-colored, sometimes the blood is so small that it is only found on a urine test. So the surprising point is this. Blood in urine does not always look like obvious blood, and after 60, repeated or unexplained blood in urine should be checked. There are many possible causes. A urinary tract infection, kidney stones, bladder irritation, kidney problems, an enlarged prostate in men, certain medicines or other urinary tract conditions that need proper evaluation. This does not mean every case is the worst-case scenario, but it does mean you should not casually ignore it. The mechanism is simple. Somewhere along the urinary tract, irritation or bleeding may be happening. The urinary tract includes the kidneys, the tubes that carry urine, the bladder, the prostate area in men, and the urethra. If blood enters that system, urine color can change. For example, imagine someone who is 71. They use the bathroom and notice the urine looks reddish-brown. There is no pain, no burning, and no fever, so they say, it can't be serious because it doesn't hurt. That is a common mistake. Pain is not the only warning sign. Some urine problems can happen without pain at first. If urine looks red, pink, brown, or tea-colored, think about recent foods and medicines, but do not stop there. If the change continues, repeats, or has no clear explanation, ask your clinician about a basic urine test. And if you have severe side pain, vomiting, fever, chills, or you cannot urinate, seek urgent care. The fifth reason is kidney stress or kidney disease risk. Let's be very clear. Dark urine by itself does not automatically mean kidney disease. Many people with kidney disease do not notice dark urine at all. Early kidney problems can be silent. That is what makes them tricky. But urine changes can still be part of a bigger pattern. The real kidney warning may not be dark urine alone. It may be dark urine plus other clues like less urination, more nighttime urination, swelling in the feet or ankles, foamy urine, fatigue, high blood pressure, diabetes, heart disease, or a family history of kidney problems. Your kidneys are filters. Think of them like a coffee filter. A good filter keeps the grounds where they belong and lets the liquid pass through. But if the filter is damaged, things can start going where they should not go. Fluid may build up. Waste may not clear properly. Protein may leak into urine. Blood pressure can become harder to control. Energy can drop. For example, imagine someone who is 64 and has had high blood pressure for years. They notice darker urine sometimes. They also have swelling in the ankles. They wake up several times at night to urinate. They feel more tired than usual. Each symptom alone may seem easy to explain. The swelling is from standing. The nighttime bathroom trips are from age. The tiredness is from poor sleep. The dark urine is from not drinking enough. Maybe But together, those clues deserve a conversation with a doctor. Ask your clinician whether kidney testing is appropriate for you. This may include blood tests and urine tests. This is especially important if you have diabetes, high blood pressure, heart disease, a family history of kidney failure, or you take medicines that may affect the kidneys. Also be careful with frequent over-the-counter pain relievers. Some pain relievers may not be safe for everyone, especially people with kidney problems, stomach bleeding risk, blood pressure issues, or heart disease. Ask your doctor or pharmacist what is safe for you. If you check your blood pressure at home, write down your readings. Kidneys and blood pressure are closely connected, and better blood pressure control can be an important part of kidney protection. Now let's talk about the most surprising reason. Dark brown urine can sometimes point to liver issues or muscle injury, not just bladder problems. Most people see dark urine and think, I need water, or maybe it is a bladder infection. But sometimes dark urine is a clue from somewhere else in the body. One example is the liver. Your liver helps process a substance called bilirubin. Bilirubin forms when the body breaks down old red blood cells. Normally, your liver helps process it so your body can remove it properly. But if bilirubin builds up, or if bile flow is blocked, urine can sometimes become dark. This may happen along with yellowing of the eyes or skin, light-colored stools, itching, nausea, loss of appetite, pain in the upper right side of the belly, or unusual fatigue. This does not mean every dark urine episode is liver disease. But dark urine plus yellow eyes or yellow skin is not something to ignore. Another surprising reason is muscle injury. Sometimes, after severe muscle injury, substances from muscle can leak into the bloodstream. That can stress the kidneys. One possible warning sign is very dark urine that looks brown, red, tea-colored, or cola-colored. This can happen after extreme exertion, a major injury, being stuck on the floor for a long time after a fall, heat stress, or certain medical situations. It may come with muscle pain, swelling, weakness, or feeling very unwell. For example, imagine someone who is 78. They fall at home and cannot get up for several hours. The next day, they feel extremely weak and sore. Then they notice their urine looks very dark, almost like cola. That is not the time to say, I will just drink water and wait. That deserves urgent medical attention. Or imagine someone starts a new medicine and then develops severe muscle pain, weakness, and dark urine. That combination should be reported quickly. So here's the recap. Dark urine after 60 can mean dehydration, especially if it comes with dizziness, dry mouth, tiredness, or less urination. It can come from medicines, vitamins, supplements, or foods, especially if the color change starts after something new. It can be linked with a bladder infection if there is burning, urgency, lower belly pain, fever, chills, or back pain. It can sometimes mean blood is present even if the urine does not look bright red. It can be part of a bigger kidney picture, especially if there is swelling, foamy urine, urination changes, fatigue, diabetes, high blood pressure, or heart disease. And dark brown urine can sometimes point beyond the bladder, including liver-related issues or serious muscle injury. The most important message is this: your body is not trying to scare you. It is trying to communicate. After 60, the goal is not to panic over every small change. The goal is to know you're normal. If your urine is usually light yellow and suddenly becomes dark brown, that matters. If you usually urinate several times a day and suddenly barely go, that matters. If a new medicine lines up with a new urine color, that matters. If dark urine comes with fever, pain, dizziness, weakness, swelling, yellow eyes, confusion, or severe muscle pain, that matters. You are not being dramatic. You are paying attention. And paying attention is one of the strongest health habits you can build. Many older adults were taught to tough it out, to wait, to not complain, and to only call the doctor when something becomes unbearable. But protecting your independence often means acting earlier. It means saying, this is new for me. It means asking, could this be connected to my medicine? It means telling the doctor, this started 3 days ago. It means noticing patterns before they become bigger problems. So starting today, try this simple habit. Once or twice a day, casually notice your urine color. Not obsessively, just calmly. Ask yourself, is this normal for me? Did I drink enough earlier today? Did I start a new medicine or supplement? Do I have burning, fever, pain, weakness, dizziness, swelling, or less urination? Has this happened more than once? If the answer worries you, call your doctor's office, pharmacist, or nurse line. Sometimes one simple phone call can give you peace of mind, and sometimes it can help catch a problem earlier. Please share this video with someone over 60 who might ignore this sign. A spouse, a parent, a sibling, a friend, or a neighbor who lives alone. Because sometimes the most helpful health warning is not complicated. Sometimes it is just this. Pay attention. Your body may be telling you something. This video is for educational purposes only. It is not medical advice, not a diagnosis, and it does not replace care from your doctor, pharmacist, or qualified healthcare professional. Urine color can change for many reasons, including hydration, foods, medicines, supplements, infection, blood, kidney or bladder issues, liver-related problems, muscle injury, and other medical conditions. If you notice blood in your urine, severe pain, fever, confusion, fainting, yellowing of the eyes or skin, pale stools, severe muscle pain, very little urination, inability to urinate, or dark urine that continues or worries you, seek medical advice promptly. If you have kidney disease, heart failure, liver disease, diabetes, high blood pressure, or you have been told to limit fluids, ask your clinician before changing your fluid intake. Now I want to hear from you. How old are you? And have you ever noticed dark urine after hot weather, after a new medicine, after illness, or after not drinking enough water? Comment your age and your experience below. Your comment may help someone else pay attention sooner.